We are committed to creating and sharing knowledge that empowers children and young people to understand the steps they can take to reduce their risks, increase their resilience to mental health problems, and improve their mental health.
Our vision is to create a world with a sound mental health for all.
People do attempt suicide.
Naturally, people are born to judge, but judging and expressing the judgment is something that we can reserve for ourselves.
We find that suicide bereavement is even more difficult than losing someone through natural death.
Be empathetic in the way you approach their situation, because if you show too much sympathy, they'll also start feeling guilty.
Greetings to you all. Welcome to our show, Tap In.
Hello and welcome to Tap In. Today we are going to be covering substance abuse treatment, which happens to be part 4. I'm your host, Trevor Robert, and in studio with me today is Tatilia and Dr. Misha. Can you kindly introduce yourself?
Hi everyone, my name is Talita Muronda, and I'm happy to have you here.
Dr. Misha, can you please introduce yourself to our audience?
Okay, thank you. My name is Dr. Samson Misha. I'm here to be here. I'm an academic and I'm very happy because Talita is my former student.
That's awesome.
And I'm realizing actually it's Talita.
Awesome. Yeah. Anyway, to kickstart today's episode, we are going to be covering how to enable recovery, to recover or to discover, and what is to be recovered. So to start with you, Dr. Misha, how does one enable recovery?
Well, we are talking here of parent-child relationships, parent-adolescent relationships, where a child gets addicted, which is actually what's happening these days, and the parent or the guardian is not necessarily a professional in terms of mental health, but somebody who is the parent or guardian to the child. There are so many ways, there are so many things, there are so many pathways they can follow to help their adolescent to recover from addiction. But then, what is important is to determine what will be the most appropriate for the type of addiction and around actually the context where the addiction has occurred. But the basic thing is it's very important not to be judgmental. Normally what happens is parents normally don't take these things lightly. The issues where the child ends up actually being blamed in the process of trying to help them recover. And that child is actually lost in the process. Because if the child is judged by the person who wants to help them, they'll certainly lose them. But our society, our families are very good actually at judging people who develop or who end up actually in such problems. So for now, that's what I can say.
All right. So in other words, you're saying some parents might actually want to take the job of professionals, or might actually want to help a kid, and then in the end result might actually be the opposite of what they're aiming for, right?
Yes, certainly.
All right, that's awesome. Okay, Tati, I've got a question. Okay. What is to recover or to discover?
Okay, I may start with what is to discover.
All right.
Okay, when we are talking of discovery, this is whereby one is directly have the knowledge and is fully aware of what is happening. So
the substance abuse addiction area.
Yes.
All right. So if that's what to recover, and we can say in order for one to enable recovery, can you possibly say it's something that one has to do on their own? I mean, do you need to come to that understanding? I want to stop doing this.
Yeah, usually when someone wants to get out of a certain circumstance, or you want to get out of something,
Yes.
you have to be aware of what is it exactly that I'm in. So therefore, you have to have that knowledge first so that you can be able to recover.
All right. So we talked about how to enable recovery. What is to recover? The question is, what is it that we are recovering, Dr. Misha?
Okay. So you asked what?
I was asking Dr. Misha what it is that we recover. When you say one is recovering or one is supposed to recover, what is it that we recover?
Okay. For example, we are saying, you were asking Dr.
You can shoot. You can shoot.
Okay. Okay, what happens is when somebody gets addicted, they lose themselves because their behaviors, their mental functioning, their identity is lost to drugs. So in recovering, they're getting back to themselves because addiction involves losing your own control of your behaviors, your thinking patterns, and your relations, almost everything. But then recovering now, it's getting back control of your own life.
All right, so in other words, we can say recovery is basically abstinence from whatever drug it is that you're using.
Yes, certainly.
All right, that's awesome. That's awesome. So as you mentioned the sense of responsibility, or should we say the range of emotions, whereby like one is going back to whether you were a happy person or you were just a moderate person. That's where you basically going back.
Certainly.
So my question is, since this is what is to recover, what are the phases that we have to like, or the stages that one has to go through for one to be a fully recovered person or user or something like that?
The problem is there's no one actually program or actually approach to helping a person recover, especially here in Africa, where there are so many methodologies to helping a person recover. But you want also to agree with me that
Yes.
as one actually goes through those processes, they actually may, after having actually maybe gone through certain phases which are different with the methodology with the programs, they may then actually relapse to the original phases. Because addiction is not actually easy, which is something which is very key. But the issue is people may actually combine different methodologies. We have a methodology which actually purely psychological, some which actually are medical, which can be used by psychiatrists. Then there can be a combination of those with the Christian perspective or the African traditional perspectives, or actual issues that actually also to do with the lifestyles.
Okay.
Yes.
Okay, thank you. There's a new presenter that just joined us. Hi, Dr. Dewa. Hello. Okay, Dr. Misha, you mentioned that there are a couple of ways that one can like go through when they are about to recover and all that. And then on my research, right, I had stumbled onto John Norcross and Carlo Di Clemente. I'm not so sure if you're acquainted with them. And they'd given me something like 6 steps which one goes through to in the phases of recovery. I'm not so sure. Are you acquainted with that? Dr. Misha?
Can you come back?
Hello?
Can you come again?
All right, I was saying, when I was researching towards this substance abuse treatment episode, right, I stumbled onto John Norcross and Carlo Di Clemente 1994 simplified recovery phases. He mentioned that there are actually 6 steps to recovery, which include contemplation, preparation, action, maintenance, and termination. Can you share anything you understand about that?
Well, like you are saying, actually, those who actually were developing in 1994, and they are very basic. But you agree with me that in America, this business of recovering from addiction is a serious one. So institutions have developed different approaches. Some actually have 2 phases. But the problem here we have in Zimbabwe, here in Africa, is we have not actually done enough to evaluate them, to test them. But in terms of deciding, certainly people actually have to prepare, they have to contemplate, they have to go through all those processes. But at the end of the day, they have to evaluate. But then the issue is, we are developing actually an approach where we need to test the efficacy and effectiveness of those approaches that have been developed elsewhere to see how they work here in Africa, here in Zimbabwe. Yes.
That's great. I like how you challenge the status quo, if I'm not mistaken. I do believe somehow we do have institutions right now in the country, right? And some of these institutions, according to stats, they have very big numbers of people who are being admitted based on substance abuse cases.
Yes.
So if they are being admitted, are they being treated? That's the question. Are they recovering?
Well, again, like I'm saying, research on these issues is not yet actually enough, but some actually are recovering. But others actually are getting back into relapse. In fact, the majority of people who get actually admitted, adolescents for that matter, are admitted for substance abuse related mental health problems. And some actually are recovering. But the effectiveness and efficacy of those treatment programs are still needing evaluation from a scientific perspective, though some actually are recovering.
Thank you. Dr. Dewa, can you hear me? Hello,
Yes,
Dr. Dewa.
Hear you, hello, good afternoon.
I can't hear you. Can you move a little bit?
Can you hear me? Brad, my network is very, very bad.
Dr. Nije has mentioned that some of the items are not really effective. My question now for you is, yes, you mentioned that somebody has to become aware, but how does one become aware that they have this problem, substance abuse?
Oh, on that one. Okay, for someone to really get away, it might be a challenge because at times people may be in something, but they don't know. So how should they become aware? They need to, and I think it's quite difficult for people to discover themselves. Yes,
right.
You can tell them yes, but for them to really perceive and accept what they are saying, usually they get into, what can I say? They get into that situation that they fail to accept it.
All right.
Of course, I wouldn't want to talk of denial here, but I'm saying even if you tell them, they cannot accept what is really happening at the moment. Like,
all right, true. You did mention denial. How is denial related to like recovery and discovery?
This is whereby someone, when he gets out, I can say maybe he gets aware of what he's into,
right,
and he cannot accept he cannot accept the present. Like, so I'm actually into this, and maybe he may have other interpretations, like what Dr. Mija was saying, especially when he mentioned on treatment. It's about beliefs here, and at times we may take things as beliefs, but those beliefs they can lead us into denial of what is really happening at the moment.
All right, thank you. Dr. Misha, back to you. I would like to know, what does it take for one to recover?
There are so many issues that are very important.
Yeah.
One is the approach that has been used, the extent to which it's effective. Secondly, the support, which is actually about enabling somebody to recover. The support from the key people around, whether they're really there. Then the other issue is whether the person is committed to ensure that they recover from the addiction. Sometimes somebody is forced or pressured into agreeing to go into a program or into a treatment program to stop substance abuse. But then the problem is they may not be really interested, because sometimes the use of drugs may then end up being part and parcel of their own lifestyle, of their own person, or on their self. So it may be difficult to have that person agree to stop using drugs. And sometimes it's also very expensive. You see, here in Zimbabwe, especially here in Harare, there are some private institutions that are now offering treatment for substance use. But you want to agree with me that they can be expensive sometimes. That's not everyone who's going to afford them. Or the people who are supposed to help the person may not help that person because they think that you voluntarily decided to use drugs. How then can I help you? How then can I fund the treatment program for you to stop using those drugs? So there are a lot of issues that are involved. And then beyond that, there also have to be lifestyle changes. Sometimes somebody has to adjust their diet, their living styles, the place where they stay, their relationships. It can be expensive in terms of their social relationships, in terms of the monies that are involved, in terms of maybe a wide range of issues that are needed to effectively get treated or recover from substance abuse.
Okay, you mentioned being committed. So in other words, you're saying if one isn't willing to stop, they won't stop.
That's actually a problem. You know what? Sometimes people who get treated for substance abuse are brought by their parents, are brought in by their guardians.
But no,
without them having sometimes agreed to stop using those drugs. So it creates problems sometimes because they may not see the problem. Because sometimes using drugs can be a symbol for a certain status or for a certain or for identity in a certain group, in a certain actual peer group. So stopping those drugs can appear like somebody is betraying themselves, betraying their colleagues, or even betraying their own social group. So to parents, it's really a challenge in what is happening. But the person whom we want to stop those drugs may not see the issue the same way the parents can be seeing that issue.
All right.
Yes.
All right, thank you, Doc. Dr. Deo, can you hear me? Nice. Hello? Oh, we're having a serious problem connection with Dr. Deo. Anyway, tell me, apart from what Dr. Misha said, what do you think it takes for one to recover?
Okay, mainly, of course, you said apart from what Dr. Misha said.
But you can even add on what you said. You can never have enough information.
But the main thing here is about being committed to, because you want to get back to yourself, right? So you have to be committed so that you can fully recover, to know what you really want. Of course, it may be difficult, like what I said. At times, someone may get back to relapse, but here it's about commitment and refocusing, trying by all means. Yeah.
All right, that's awesome. Anyway, I would like to believe, Kuti, abstaining, or should we say, stopping abusing drugs may become very hard. Very, very, very hard.
Yeah.
Much more difficult than actually what people do believe.
Yeah.
But is there like certain ways we can help someone become committed? A program or a certain metric we can use for someone to see the value they have or the potential they have, so that they actually take it as a task to recover.
Okay, like what you said it's actually difficult for people to get out of an addiction than how they entered into it.
Right.
So all they need is support. Of course, the main issue is on themselves, how they perceive it, how they take it, and how do they really need to change. But all it rotates on support.
On support.
Yes,
Right.
and like what Dr. Misha said about change of environment and change of friends, relationships, and trying by all means to abstain. And at times you really need to cut off even some of the relationships, like the friendships and the environment, because at some point you may get to know that someone is actually vulnerable, like is exposed,
all right,
like to that environment where drugs are just everywhere and they can be easily you can easily get them.
All right.
But here we are saying maybe you need to get out of that environment, you need to change and all that, which is quite difficult at some point and very costly, like what.
All right. Dr. Misha, as Tati has said, there might be need to cut off some people, but what if those people are the people who are making your life your life? Let's say maybe it's your father, or maybe it's your mother who's abusing them drugs. How does one change lifestyle or maybe change environment when it's your parents? You can't run away from your family, right?
Yes, you cannot run away from them. Sometimes, but not always. Sometimes, but not always.
So in other words, you're saying if it means good you approve you can even just run away. That's what you're saying, right?
Yes. But you need actually to be aware of this issue that relations these days relations is just physical.
Yeah.
They can even be digital. Instead of taking your parents as your role models, you can adjust that. Your model can actually be somebody in America, somebody in South Africa, somebody in your church, somebody at your church, but still stay with your parents. But when somebody gets to adolescence, the problem is their models normally change. Instead of them being parents, sometimes they become peers. So, and peers are very important and significant for adolescents. So they end up sometimes playing around with their peers who are there and whose lives revolve around their own lives as adolescents who are abusing drugs. So it can be difficult for them to disconnect from their peer groups sometimes. And when they are parents, the issue is the parents may be the ones who are providing them with level of support, or even the support for treatment.
Yes.
Which can create actually problems sometimes. But even if there are problems, sometimes somebody can end up maybe staying with their uncle, their brother, their aunt, or whoever, getting away from their parents. Some even end up staying with their pastors. It's happening these days.
All right.
Yes, yeah.
I love how you managed to give us a close to home approach, since you mentioned that economic restraints are actually a big problem when it comes to people who are trying to recover in this country of ours.
Yes.
So in terms of lifestyle, right? Lifestyle maybe you're living in the high density, you know, too many people around and all that. In actual fact, economically, Zahoma, you know, if you get what I'm trying to say, right? So, could it possibly be the lack of financial freedom that could be causing this problem?
It's very complicated.
Yes.
Because you see people from different socio-economic groups who abuse drugs do so differently. It's not just the poor or those who are struggling financially who abuse drugs. No, that's not it. Even those who are from well-to-do families are abusing drugs, one or the other. In fact, they are using and buying more expensive drugs. And they're undergoing very expensive treatment programs, but far away from public attention. It's the poor who go to Pararinyatwa. It's the poor who go to Harare Hospital. The rich are approaching private institutions where they're getting support. So the issue of you abusing drugs. It's not just about. We can be simplistic if we say the poor abuse drugs as a coping mechanism. When you can realize that even the rich, there are a lot of mbingas out there, business people, medical doctors, pharmacists, lawyers, lecturers who are abusing drugs, who sometimes don't have financial problems, but they're abusing drugs because their lives actually sometimes end up revolving around use of drugs, use of substance. And there are different types of substance. That's why you see sometimes athletes, they're sometimes banned after taking some of these psychoactive drugs, which may not consider to be actually really a problem for us here. So the issue of finances is normally a problem, but normal to those who are poor. But for those who are rich, sometimes it's not like people are using drugs because they're in financial problems. And people who are rich, sometimes they're using a lot of money to help their kids get treated from substance abuse. Here in Zimbabwe, here in Harare, the issues are this issue of substance abuse is very complicated. You see, even within colleges, in universities, and even among female students, among mothers, people are now using drugs, maybe unlike before, but the extent and the nature of substance abuse in Zimbabwe has not actually been studied enough so that people can be aware of really what is happening in our country, in our cities, even the rural areas. Maybe the problem is the problematization has gone beyond what used to be. But even before, in the 90s, in the 80s, even during the colonial period, people have been using drugs at high schools, some even primary schools, at primary level. They've been using drugs. And the drugs have been priced, have been supplied and priced in ways that are actually consistent with the socioeconomic status of the people who are selling them or who are using them.
Okay. Anyway, I like how both you and Doc address that substance abuse is actually a disease and it needs to be treated. I really envy that. My question is, what should I say? What I would ask for you is advice for somebody who is like trying to recover, but they've relapsed a couple of times. What would you advise that person who's trying to recover and relapsing?
Okay, all I can say is it's not really something out of this world that we continue getting back in things that we actually want to get out of.
Yeah.
So they need to keep trying. Of course, maybe for the first time, they may try to get out of this addiction, and they find themselves again in the same situation that they are trying to run away from. So all I can say is they really need to continue seeking help. And even not only to those. I'm not talking here of only those who are suffering from the addiction.
Yeah.
But just for anyone else, we need to support them. Like we are not supposed just to continue talking about the same thing, kuramba chingova rerera and something and so forth. But what I'm saying here is they really need support. Of course, they got into these things. Some of them, like what you were saying, they got it. They copied it from the environment. Automatically, they found themselves in abusing of drugs and substance things. So they really need us. They need our support. So all I can say is they have to keep seeking help, and we continue to support them. They can actually get out of it. It's possible, although it may be difficult, but it's very possible.
All right. Dr. Misha.
Yes.
I would like to understand that sometimes people get to abuse drugs because of some mental illnesses, or they might actually get to be mental ill because of abusing drugs. But some of them at some point, they come to a certain realization that is to recover, to become aware of the substance abuse that they're using. And most probably, maybe it's long-term or short-term effects. What would be your advice to somebody who's trying to stop?
Somebody who's trying to stop.
Yes.
It's the first important thing is they must realize that there's a lot that must be learned about substance abuse.
True.
Yes. They would need to know what the substance can do to their bodies and how they can stop. And stopping substance abuse, especially when somebody has gotten addicted to them, is not as easy as it can appear.
Hello.
This person in turn.
Is for people who are around. It's very important that they should provide care and love.
True.
Because they are trying to help. But that comfort and that care and love must not be used as a weapon. It's like saying, because I care for you, you must stop using the drugs. It's not like that. And there must not be conditions. It's like, if you don't do this, I'm going to do this. Because it's not that easy. They can actually be withdrawal issues that can result in a lot of health problems for the person who wants to stop using or abusing drugs. So it's very important that the people must approach professionals, certified professionals, who should be able to give them the professional support in getting over the drugs. They need to be aware of what it means to stop using those drugs. And there must be support systems for those who are trying to stop use of drugs. And it sometimes can be a lifelong process. Somebody can stop using drugs maybe for a week or for a month, but then they can be relapsed later on. And they may not need to be very harsh on themselves for having relapsed. It's actually very important. And then there are actually some support groups out there of people who have actually who have abused drugs before. It's actually very important that if they so wish that they get connected with such people.
Yes.
Yes.
Thank you. As we come to the end of this episode of ours, substance abuse treatment, I would like to recap. We talked about what it is to enable recovery, what is to recover, and the phases of recovery. As Dr. Mijay said, in our country, we've had a sort of like challenges as far as drug abuse is concerned, but that doesn't stop the youth from abusing drugs. I would urge whosoever might be, capable of helping or aiding with this. And in the end, as a wrap up, I would like to, advise people who are trying to quit. Do not quit on quitting. Because, sometimes yeah, it's just the action you take, right? To say, I want to stop. It's just that assertion. You keep at it, and trust me, one day you might as well find yourself, sober, just like me. Anyway, any few words you'd like to add before we wrap up? You, Tati.
Okay. Yeah. Like what my brother here said, don't quit. Keep on fighting. We can conquer together. We can. Thank you.
Dr. Misha, any closing remarks?
Well, I think it's very important for parents and anybody out there listening that they should provide the needed necessary support for those who want to quit. And it's also very important that we try to understand what substance abuse involves and what the treatment may involve and what that quitting may need. And that there are a lot of people out there who are ready to assist in one way or the other. So when somebody is in a problem, they might not think that they are alone. There's nobody out there to help them.
All right. Thank you, Dr. Misha, and thank you, Tati. To close off, I would like to say, whatever it is you're going through, drug abuse is never the answer. Till we meet again, I'm your host, Trevor Robert. Sayonara.